Frozen shoulder, adhesive capsulitis. Relief through shoulder embolization at the leg pain clinic. What is frozen shoulder? Frozen shoulder is a condition where the shoulder joint capsule becomes inflamed and thickened, leading to pain, stiffness, and restricted movement. It most commonly affects people between 40 and 60 years old, especially women and those with diabetes, thyroid disease, or prior shoulder injuries. Pathophysiology. Why does it happen? The shoulder joint is surrounded by a capsule of connective tissue. In frozen shoulder, this capsule becomes inflamed and tight, forming adhesions, bands of scar-like tissue that restrict movement. As inflammation persists, it leads to reduced blood flow, chronic pain, and a loss of flexibility. The condition typically progresses in 3 stages. 1. Freezing, increasing pain, and gradual loss of motion. 2. Frozen, severe stiffness with lingering pain. 3. Thawing, slow return of movement over months or years. Common symptoms: dull, aching pain in the shoulder, stiffness and inability to lift the arm fully, pain that worsens at night or with movement, difficulty with everyday tasks like dressing or reaching overhead, symptoms lasting months to years without proper treatment. Treatment options: 1. Conservative measures, physical therapy, stretching and mobility exercises, NSAIDs, over-the-counter anti-inflammatories, corticosteroid injections, temporarily reduce inflammation, ice or heat therapy. These treatments help in mild to moderate cases, but often fall short in chronic or advanced stages. 2. Surgical options: manipulation under anesthesia, MUA, arthroscopic capsular release. While effective for some, these options involve anesthesia, surgical risk, and downtime. 3. Shoulder embolization, a non-surgical alternative. Shoulder embolization is an image-guided, minimally invasive procedure that targets the inflamed blood vessels, contributing to pain and inflammation in the shoulder joint capsule. How it works. A small catheter is inserted through a wrist or groin artery. Dr. Anwer uses real-time imaging to locate and embolize, block, the abnormal arteries around the shoulder. Tiny particles are injected to reduce blood flow to these inflamed areas. This reduces pain, inflammation, and stiffness without affecting healthy tissue. Benefits of shoulder embolization: no general anesthesia or incisions, outpatient procedure, go home the same day, rapid improvement in pain and mobility for many patients, minimal downtime, typically return to activity in 24 to 48 hours, may help avoid surgery altogether. Dr. Bilal Anwer, leading the way in shoulder embolization. Dr. Bilal Anwer is a board-certified interventional radiologist with expertise in non-surgical treatments for chronic joint pain. At the Leg Pain Clinic, he performs shoulder embolization using advanced imaging and precision techniques to treat frozen shoulder at its source. Patients from across the Houston area seek out Dr. Anwer for his innovative, compassionate care and his track record of minimizing pain and restoring mobility, all without the need for invasive surgery. Get back to moving freely. If you're living with the pain and limitations of frozen shoulder and want to avoid surgery, shoulder embolization may be the answer.